a meeting under the auspices of the West African Health Organization on the 26th and 27th of the experts, committee of experts. We're inviting the WHO and the Center for Disease Control to attend. And then after the experts meeting, we're going to have the health ministers meeting. So all the ECOWAS health ministers are going to come here so that we hold a meeting. And then after that, if it is necessary, we'll hold another emergency meeting of the heads of states, you know, to agree on the measures that we must take going forward.
The focus of the UNAIDS Executive Director, who is also Under Secretary General of the United Nations, Michelle Sidibe, was to discuss achievements made in the reduction of HIV/AIDS prevalence so far. He lauded Ghana's efforts in reducing the prevalence of the disease, but called for attention to be focused on areas such as budgetary allocations for the local productions of antiretroviral drugs.
Ghana is showing that we can really control this epidemic. We are seeing decline on new infection. We are seeing decline on a number of deaths. We are seeing also that it's possible by 2015 to announce that we don't have new babies born with HIV anymore in Ghana. It will be certainly the first time that we can say that we have a generation free of HIV. And that is the beginning of the end of this epidemic. I want you to really continue to help us with, of course, your political advocacy, but also budgetary allocation. All of that are very important. That you continue to push your peers to have the possibility to really produce medicine for the continent. Ghana is a good example. And we can really bring your peers to come to discuss, to see how we can have a regional hub in Ghana.
President Mahama, however, said steps are already being taken in that direction to further deal with the disease.
Some of the strategies we're doing is to stimulate local production of ARTs. And so as part of our strategy to create Ghana into a hub for pharmaceutical production, our Export Development and Agricultural Investment Fund, you know, made some money available to some pharmaceutical industries in Ghana, and the bulk of the funds are to be used to improve and increase production of prophylactics and ARTs. Yes. And so we are increasing the supply of ARTs locally, but also aiming to become the hub for procurement of ARTs within the sub-regions. So, as you said, our next targets are to get 90-90-90, you know, have at least 90% of our people knowing what their HIV and AIDS status is. We're committed to putting our own resources in, and that's why I said we're supplementing.
Yes, I know.
Formerly we used to rely almost completely on external financing of our HIV and AIDS program, but now we are putting in some of our own money into our program. Yeah, but I still understand that we can make a token donation to UNAIDS, you know, to show our commitment towards the global response.
Commenting on the spread of the Ebola virus in the sub-region, President Mahama said some ad hoc measures adopted in some affected countries to deal with the disease have the tendency of rather exacerbating the situation, hence the need for the regional meeting to discuss more helpful measures.
A lot of the responses, you know, to the epidemic are ad hoc. And so even though we have the WHO guidelines showing what we need to do, countries are doing other things, you know, canceling air travel, you know, banning people from those countries into their countries, closing borders, and so on and so forth. I think that we should maintain a level head and not panic. When we panic and put in place ad hoc measures, it rather exacerbates the problem rather than reduces it. For instance, it's very difficult to get flights into Sierra Leone and Liberia now, and there are medical experts and other people wanting to go and help, but cannot get flights into the place to go and help. And so I think that it's necessary for us to hold these meetings of the health ministers and the heads of state so that we can agree the measures that we need to take.
He said leadership of the sub-region is committed to dealing with all these health challenges.
So we need to also standardize what the screening procedures are, what the isolation and quarantine procedures are. And then also, aside from our domestic surveillance and tracking measures to be able to collaborate in terms of information sharing so that we do the tracking and surveillance across our borders.
Gifty Andopia, Joy News, Flagstaff House.